femoral articular branches, which are going to be there as a radiological target on the top of your acetabulum, in that area where my laser is pointing. And you will have the obturator branches, which are going to be at the lateral edge of the teardrop. Now, teardrop is actually a radiological finding, it's not an anatomical finding. So if we do an AP view, and we will see how that teardrop disappears. So if you look at the current view, that's going to be the AP. So we're doing the AP view. An AP view, there's no teardrop. Now keep an eye on that area, and we're going to do 15 degrees tilt, ipsilateral tilt, because we're looking at the left hip. So we're going to do 15 degrees tilt at the left, and we will then do the X-ray, and now we have a teardrop. Okay, you see the teardrop, right? So this area is what we actually want to actually target, right? Can we have a bit more tilt and see if we can make that teardrop look much better? Yeah. Okay, so do you appreciate that bit? So it's this bit we're talking about. That's why, you know, looks like a teardrop. All right. So with regards to the femoral part, we want the needles to be somewhere here. Okay. So the very simple way to do femoral is you want to start as you would do for your hip joint. So let's unfreeze the image. So currently you see what you do for your hip joint injection. Okay, on the current screen you have acetabulum, femoral head, and then you have your femoral neck. Okay, agree with that? That's your iliopsoas tendon, right? So we do a femoral hip joint injection. You come here, land in between your head and neck junction, and inject, and then the local anesthetic and steroid will flow into the capsule. Okay? Now what I'm going to do here is I'm going to just make the probe a bit horizontal, because to do the hip joint injection, you align your probe like that along the axis of your hip joint. Now what we're going to do, we're just going to make this probe go horizontal, and we're going to keep an eye on these two structures, the acetabulum and the femoral head, and then we're going to go up, 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 and see. We want to see these two meeting and becoming a single structure, which is going to be your roof of your acetabulum. When I see the roof of acetabulum, the only trick that you need to do is the lateral edge of the probe here. The lateral edge of the probe here, you're going to turn that along the direction of your inguinal ligament. Okay, and the picture you get here is the anterior inferior iliac spine, iliopubic eminence, and that's your target for your articular branches of your femoral nerve. So if you look at the X-ray, that's where we've gone now, right? So we started scanning with the ultrasound there, then we moved up, we looked at the acetabulum, we looked at the femoral head, and then we just carry on going up, and then we turned the ultrasound probe that way, so we could see the anterior inferior iliac spine and the iliopubic eminence. So if I put my needle in plane there, that's my target radiologically achieved using the ultrasound. That makes sense? Yes. Okay, so but let's sort of, you know, get that image, and we will do the